Hi, here are key diabetes management strategies. If you're not yet subscribed to our channel, kindly subscribe. Diabetes management strategies. 1. Lifestyle modifications. Healthy diet. Encourage patients to follow a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Emphasize portion control and carbohydrate counting to help regulate blood sugar levels. Regular physical activity. Advise patients to engage in at least 150 minutes of moderate intensity aerobic exercise per week, such as brisk walking, cycling, or swimming. Strength training exercises should also be incorporated at least twice a week. Weight management. Support patients in achieving and maintaining a healthy weight through a combination of diet, exercise, and behavior modification techniques. 2. Medication therapy. Oral medications. Depending on the type and severity of diabetes, oral medications such as metformin, sulfonylureas, meglitinides, DPP-4 inhibitors, SGLT2 inhibitors, and thiazolidinediones may be prescribed to lower blood glucose levels. Injectable therapies. For individuals with type 2 diabetes who cannot achieve adequate glycemic control with oral medications alone, injectable therapies such as glucagon, like peptide-1 receptor agonists, GLP-1RAs, and insulin may be initiated. 3. Insulin therapy. Types of insulin. There are different types of insulin available, including rapid-acting, short-acting, intermediate-acting, and long-acting insulin formulations. Insulin administration. Educate patients on proper insulin administration techniques, including injection sites, rotation, and storage. Insulin titration. Monitor blood glucose levels regularly and adjust insulin doses as needed to achieve target glycemic control. 4. Blood glucose monitoring, blood glucose, SMBG. Instruct patients on how to perform SMBG using glucometers to track their blood sugar levels at home. Continuous glucose monitoring, CGM. Consider CGM systems for patients who require more frequent glucose monitoring or have difficulty achieving target glycemic control with SMBG alone. 5. Patient education and self-management. Provide comprehensive education on diabetes self-management principles, including medication adherence, carbohydrate counting, meal planning, physical activity, and stress management. Empower patients to recognize and respond to hypo and hypoglycemic episodes promptly. Encourage regular medical checkups, eye exams, foot exams, and dental care to prevent and detect diabetes-related complications. 6. Psychosocial support. Address psychosocial factors and emotional well-being as part of diabetes management. Offer support services, counseling, and resources to help patients cope with the emotional challenges associated with living with diabetes. 7. Multidisciplinary care team. Collaborate with a multidisciplinary healthcare team, including primary care physicians, endocrinologists, nurses, dietitians, pharmacists, and diabetes educators, to provide comprehensive and coordinated care for patients with diabetes. 8. Individualized treatment plans. Recognize that diabetes management should be individualized based on patient preferences, goals, lifestyle, comorbidities, and risk factors. Involve patients in shared decision-making and goal-setting to optimize treatment outcomes and adherence. By implementing these diabetes management strategies, healthcare providers can help patients achieve and maintain optimal glycemic control, reduce the risk of complications, and improve overall quality of life. Regular monitoring, education, and support are essential components of successful diabetes care. Diabetes complications and strategies for risk reduction. Diabetes complications. 1. Shorter complications. Hypoglycemia. Low blood sugar levels can lead to symptoms such as sweating, trembling, confusion, and in severe cases, loss of consciousness or seizures. Hyperglycemia. High blood sugar levels can cause symptoms such as increased thirst, frequent urination, fatigue, blurred vision, and slow wound healing. If left untreated, hyperglycemia can progress to diabetic ketoacidosis, DK, or hyperosmolar hyperglycemic state, HHS, which are life-threatening conditions requiring immediate medical attention. 2. Long-term complications. Microvascular complications. Diabetes can damage small blood vessels throughout the body, leading to complications such as diabetic retinopathy, damage to the blood vessels in the retina, which can result in vision loss or blindness. Diabetic neuropathy, nerve damage that can cause pain, tingling, numbness, or loss of sensation, particularly in the feet and hands. Diabetic nephropathy, kidney damage that can progress to chronic kidney disease and end-stage renal failure. Macrovascular complications. Diabetes increases the risk of atherosclerosis, which is hardening and narrowing of the arteries, can lead to cardiovascular diseases such as heart attack, stroke, and peripheral artery disease. Risk reduction strategies. 1. Glycemic control. Achieving and maintaining target blood glucose levels through medication adherence, lifestyle modifications, and regular monitoring can help reduce the risk of both short-term and long-term complications. 2. Blood pressure management. Controlling hypertension through lifestyle changes, for example, diet, exercise, weight loss and antihypertensive medications, can help prevent or delay the progression of diabetic nephropathy and reduce the risk of cardiovascular events. 3. Lipid management. Managing dyslipidemia through diet, exercise, lipid-lowering medications, for example, statins, and lifestyle modifications can help reduce the risk of atherosclerosis and cardiovascular disease in individuals with diabetes. 4. Smoking cessation. Encouraging smoking cessation and providing support services can reduce the risk of cardiovascular complications and improve overall health outcomes in individuals with diabetes. 5. Regular screening and monitoring. Regular screening for diabetes-related complications, including eye exams, foot exams, kidney function tests, and cardiovascular assessments, allows for early detection and intervention to prevent or mitigate the progression of complications. 6. Healthy lifestyle choices. Promoting a healthy lifestyle, including a balanced diet, regular physical activity, weight management, stress reduction, and adequate sleep, can help improve overall health and reduce the risk of diabetes-related complications. 7. Medication adherence and self-management. Encouraging medication adherence, self-monitoring of blood glucose levels, and adherence to treatment plans can help optimize glycemic control and reduce the risk of complications. 8. Education and support. Providing comprehensive education, counseling, and support services to empower individuals with diabetes to make informed decisions about their health and self-management can improve adherence to treatment and reduce the risk of complications. By implementing these risk reduction strategies, healthcare providers can help individuals with diabetes minimize the impact of complications and improve their overall quality of life. Early detection, proactive management, and patient-centered care are essential components of diabetes care and prevention of complications. Please do like video and kindly subscribe. Thank you.